Hey everyone, and welcome. Today we are going to talk about what is the trauma treatment going to look like in 2023? Where has trauma treatment been so far, and where is it going in 2023? So we have a few points that the team and I came up with that we're really excited to share with you. Number one, we see that in 2023, there is going to be less medication that is as quickly prescribed and as prescribed as it is so far. So more and more, we're seeing that there is a push towards either plant-based medicine, more natural supplements. And even though people will obviously be prescribed medications because they are necessary in so many cases, it's going to be less of a go-to, less of an extreme jump from nothing to high dose. It's going to be a lot more conservatively used. And also it's going to be something that is kind of less of a dose. We're going to jump there less quickly, and also hopefully going to be using a bit more plant-based medicines. If you look up MAPS, so MAPS is also looking into how can we heal trauma with psychedelic assisted psychotherapy. So that is just one example of how plant-based medicine is being used for trauma treatment in really interesting university-based studies with psychiatrists and psychologists present. And so going from such an over-medication for mental health, we're moving a little bit away from that. And even though, of course, meds will be used, it's not going to be as quickly as high doses. And we're looking for a more holistic approach, which is really exciting. Number two, we're also understanding more and more with trauma treatment coming into 2023 that trauma doesn't only affect the head, it doesn't only affect our mind and our brain. It affects the body at a cellular level. It affects the body at an immune level. And so looking at experts in trauma treatment such as Peter Levine, Gor Mate, Bessel van der Kolk, Deb Dana, we see that oftentimes we're talking about how trauma affects us hormonally, how trauma affects our dopamine levels, our serotonin levels, how it affects our gut lining, how it affects the body actually being so hypervigilant, where we're not only hypervigilant that we're looking around and afraid that someone's going to attack us, but it goes down to the cellular level where their autoimmune response like mimics the way that we're responding with hypervigilance, meaning that at the cellular level, the body starts attacking itself if the trauma is left untreated and, with extreme levels of high cortisol and hypervigilance and, no treatment happening. So moving towards, hey, how can we treat the body once again more holistically, saying, okay, we are now looking at trauma, how it affects the immune system, how it affects our hormone levels, and how we can once again reapproach trauma treatment, not only as how can we talk about it, because talk therapy is one component, but it's not the whole picture, but also how can we address the hormones, how can we address our trauma from a cellular level, from a physiological perspective, right? The other thing that our team came up with for where this is going based on our research is now that we are post-COVID, trauma treatment has become more online, more accessible, and a little bit more affordable because it's online. And so we are seeing that it is moving in that right direction. Of course, there are the pros and cons to that, right? It's always nice having a human being sitting with you in the same room in front of you. It's always nice, having that one-on-one in-person interaction. At the same time, mental health is so incredibly important that when we do bring it online, it's nice that we make it a little bit more affordable, we make it a little bit more accessible. And so 2023, that's where we've been going, and that's where we're heading more towards. Another big part of the conversation heading into 2023, we have intergenerational trauma conversations, generational trauma conversations, looking at trauma not as a single event, but also just as, hey, this is what is happening in terms of cycle abuse. These are the implicit messages and habits that I've adopted because of where I was born, or the family I was born in, or the community I was born in, or maybe even the color of my skin or not the color of my skin, right? So we're talking about a lot more systemic oppression, racial violence, and recognizing how the global trauma and the macro trauma affects us as individuals, which is a really interesting conversation to have. And we are having more of those conversations in 2023 as we head into this year. The last thing that our team came up with, which is really exciting also, is that men are acknowledging the importance of mental health more and more, not only in terms of therapy and the importance of, getting mental health help, but also the importance of how can they use more body-based approaches. So whether that's yoga, whether that's meditation, really moving more towards an embodied approach, away from this toxic masculinity, away from using anger and aggression as their only means to express themselves, and moving more towards trauma-informed conversations, moving more towards what does mental health really mean for me as a man, and really being able to expand those conversations in terms of men and mental health. So there are some points for you to dwell on and to just sit on and dwell on, and also I think to celebrate as we move into 2023. I hope that you've appreciated this little chat, and I look forward to seeing you again soon.